How you doing for all my hiatal hernia acid reflux sufferers? I've never done a video on this. We're gonna dive into the nerve supply to the stomach and the diaphragm. Okay, so I talk about nerves all the time because the nerves are the communication wires that connect our brain to the rest of our body, the central nervous system. So let's talk about nerve supply to the stomach and the diaphragm. Well, the diaphragm gets its nerve supply from the phrenic nerves at C3 through C5. That's, obviously it runs all the way down throughout the body, but the phrenic nerve and along where the hiatal hernia happens, the stomach, but the phrenic nerves found mainly in C3 through C5, that controls the motor function to the diaphragm. Motor function meaning the muscles to the diaphragm, which is really important when it comes to hiatal hernia. So when patients come in, we have patients that come in and they want to be treated for hiatal hernia, and they'll say, I don't really want my neck adjusted. Okay, I'll half-ass the treatment for you then. Maybe they don't need a phrenic nerve stimulation. Maybe they don't need that with an adjustment, right? Maybe there's no problems in the mid-cervical spine, but it's rare. It's really rare. I almost always find a problem there at C3 through C5. So phrenic nerve, that's your nerve supply, motor nerve supply to the diaphragm. Then you have the sensory nerve supply to the diaphragm, which comes from your intercostal nerves. Those are the nerves that come out in between the ribs, okay? So that controls the sensation, this pain that you might have in the diaphragm, okay? Now, let's go to the stomach. Stomach nerve supply. How many of you can guess what that is? I think you guys already know because I talk about that nerve all the time. I love that city when I want to go gamble, which I don't even gamble, but every year I'm there in Vegas for the chiropractic conference. But what is it? The vagus nerve. So some of you probably don't know what the vagus nerve is. The vagus nerve, I've done so many videos on that. Please, I've explained that from A to Z, the vagus nerve. You name it, I've done the video on the vagus nerve. So please check out those videos if you want to dive more into the vagus nerve. But the vagus nerve controls the stomach. It's the parasympathetic control to the stomach. And the sympathetic control to the stomach is the celiac plexus. And the stomach gets its nerve supply, because most of you are saying, well, the celiac plexus and the vagus nerve, and what's he talking about? Yeah, the vagus nerve is not on the west coast, it's in your stomach. So it runs right up along where the diaphragm runs through your hiatus, right? So the vagus nerve, again, is the parasympathetic control to the stomach, but the nerve supply to the stomach from the spine comes from T5, which is about here, to T9, which is about here. T5 to T9 is the stomach's nerve supply. So when a patient says, I don't want to really be adjusted, and I have a hiatal hernia. Okay, you want me to half-ass it? Because that's a definite adjustment that I find on everybody with a hiatal hernia. Tightness, poor posture in that area, maybe thoracolumbar scoliosis. Yeah. T5 through T9, you definitely need an adjustment. That's where the connection comes in. Now, that's nerve supply to the stomach and the diaphragm. But there are other things that you can do to take pressure off the vagus nerve, which is that nerve supply to the stomach, and the intercostal nerves and the phrenic nerve. And number one is pulling the stomach down, correcting the hiatal hernia, okay? So that's it. That's pretty much it. That is nerve supply to the stomach and the diaphragm. I hope that helps you. I hope you learned something. And if you did, subscribe, please. 4 new videos every week. I appreciate you. That's what keeps this channel going. So please go ahead and feel free to hit that like button. And if you have any comments, I am doing videos this week. And I do this at least once a month. I go through comments and I pick out some of the best ones and I do videos on them. So maybe you'll be next. Thanks for tubing in. Thank you guys so much. If you got anything from this video, or even if you just like this view of the Empire State Building and the Chrysler Building,
give me a like, and don't forget to subscribe. Appreciate you guys.